Dr. Peter Glidden, your steadfast advocate for health. Thanks for clicking through. Inquiring minds would like to know, where did all the scientists go? Over the last 12 months, we have been inundated with bad science concerning all things coronavirus. The origin of the virus, the actuality of the virus, the genotyping of the virus, masks, effective or ineffective, asymptomatic carriers, and more importantly, most importantly, effective clinical strategies, science-based, clinically verified strategies to prevent it and deal with it once you have it. Now, you've been getting one side of the story, and you can postulate all you want about why. I have a pretty good reason why you've been only getting one side of the story. We haven't had a free medical market in this country since 1912. So what's that? 109 years now of a monopolized medical marketplace, monopolized by Big Pharma and the American Medical Association. And look, here's a fun fact to know and tell. Your medical doctor may be the nicest person that God ever created, but your medical doctor does not practice medicine. Your medical doctor practices one type of medicine, referred to as allopathic medicine. Allopathic medicine, as it turns out, is really good for trauma care, surgery when it's necessary. That's it. For chronic disease, it's the wrong dog for the hunt. It is an abject failure, as is evidenced by the startling rise of Alzheimer's, autism, obesity, type 2 diabetes, arthritis, the lessening of life expectancy. While we have been under the exclusive care of conventionally trained allopathic medical doctors, our health is getting worse and our life expectancies are getting shorter. If you're in an automobile accident, heaven forbid, or have a broken leg or a bleeding artery, then they are, in fact, your go-to person, the right dog for that hunt. But for the things that most people go to the doctor for most of the time, it's a failed methodology. And especially when it comes to preventing and treating a viral infection, also not such a great track record. But the only point of view that you are hearing is the MD point of view. And quite frankly, enough is enough. Over the last 12 years, my licensed naturopathic colleagues and myself have treated thousands of people diagnosed with COVID-19. We've also developed and delivered prevention strategies. These are not theoretical. These are things that we've actually developed and delivered and looked to see whether or not they're effective. Now that 12 months has gone by, more or less, I can tell you with a high degree of certainty what you need to do in order to optimize your body's immune system, in order to prevent coming down with a viral infection, number one. And number two, what to do, heaven forbid, if you do develop COVID-19. These are strategies and therapeutics that are outside of the zone of MD-directed allopathic medicine. Your medical doctor knows nothing about these therapeutics because they have no training and no clinical experience with them. Myself and my colleagues do. You should lean heavily on our clinical experience. It literally could save your life. So go to riseupintohealth.com and purchase my document, Coronavirus Myth Busting, plus my prevention and treatment strategies gleaned from almost a year now of clinical experience. A little bit of knowledge goes a long, long way here, ladies and gentlemen. Rise up into health. It's about time. I am and always will be your steadfast advocate for health, Dr. Peter Glidden. Thanks for your time. Now go to the website and inform yourself.